Warning, this podcast is intended for consenting adults. We're talking about all things non-monogamy, which means some of our conversations are going to get down and dirty. Please know we are not professionals, and these are strictly our views and opinions and in no way represent the opinions of our employers. We respect others' opinions as we know everyone in the world of non-monogamy does it differently. Hope you enjoy.
Hey everybody, welcome to another exciting episode of 3 Shades Deeper. I'm your host, Anthony Grayman, and as always, I am joined by my beautiful wife,
Pinky Grayman,
and my salacious girlfriend.
Ava Moore.
How are you ladies doing?
wonderful.
Great.
I am so happy to hear. Once again, we're here doing another episode of Deeper, and as our listeners know, we try to touch on topics that are a little bit more serious,
Deep.
so to speak. Deep, yes, serious. And one that, especially in the space that we operate in, is sexual health and wellness. Wouldn't you ladies agree?
Yeah, 100%.
Okay.
Such a priority that we talk about constantly among all of us.
Well, we talk amongst all of us a lot, but if I'm going back and looking at a lot of the episodes that we've recorded, we've spoken a lot about consent.
Right. We haven't.
And while consent is part of safety and consent is part of the conversation, one of the other conversations that is very important to have is about one's sexual health and STI status.
And I think
So
what
important.
I've learned from this amazing guests that we have, that we don't know shit.
We have guests? Oh, I didn't know that. Okay, yeah. No, we wouldn't be doing this because we're not experts in this, and not necessarily saying that, well, I'll let them put what they do in perspective. But I think they have a little bit more experience in this. So
A lot of it more.
Yeah, a lot of it more. So without further ado, I'd like to introduce Robert and Anna from Shameless Care.
Welcome.
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 Hi.
Well, hi there.
Hey,
Thanks
how
for
are you?
joining us.
Thanks for joining us. And if our listeners can understand, we feel very much underdressed for this interview, but that's okay. We're audio only, but
Yeah, that's the benefit of it.
yes.
Yeah, they've got us beat in the fashion department right now.
Yeah.
So tell us about yourselves. Like, Robert, why don't you start out and tell us a little bit about yourself?
Sure. Well, my name's Robert, and I've been in the lifestyle for, goodness sakes, about 20 years now. And probably about 5 years ago now, I had gotten an STI test like I had done every 6 months for years, and was looking at a negative, free STI-free panel result when a partner texted me and told me that I had given her gonorrhea. I was really shocked by that. One, I felt completely fine. The other one is, I'm literally looking at the test results, which are negative. And she said, well, have you ever been throat swab tested? And my thought was, well, what the hell is that? I'd never even heard of that before. And she said, well, I think you need to be throat swab tested. And then I had to go to 3 different doctors until I finally found one who knew what that was. Took me 4 days. And sure enough, I had a completely asymptomatic case of oral gonorrhea and had, in fact, given it to her. And then she had turned around and given it to her husband. She was also asymptomatic, but he exploded with symptoms. And I've since learned that that's pretty common with STIs. I mean, people don't pass STIs that they know they have. They're passing STIs that they don't know they have, which is why screening is so critically important.
Yeah, sometimes we don't know what we don't know. And in the work up to this, recording this and speaking with you, there are a lot of other tests that are out there, a lot of other STIs which people don't test for. And we're going to get into that a little bit later on. But Anna, why don't you introduce yourself to
hi there.
our
Yeah,
audience?
That's me. Well, hi, everyone. I'm Anna. I'm actually a physician assistant. I've been a PA for 16 years because time has no meaning anymore. And my clinical specialty is actually oncology, But I've been in the lifestyle for, oh goodness, over 6 years now. And this is just one of the things that Robert and I have been collaborating on for over 3 years now. And I tell you what, even for somebody who's gone to, a medical school, I have learned so much just about STIs, how they're spread, and honestly about how insufficient our training is in the medical world when it comes to testing people and what needs to be tested and how. So it's been really eye-opening for me and also very invigorating to be able to teach people about this and just, help teach other clinicians as well about this. So it's been really a nice experience for me.
So most people, when they hear about testing and being safe, the big one that usually comes to a lot of people is HIV, also gonorrhea, syphilis. Help me out, ladies. Any chlamydia?
Chlamydia is
yeah.
another one. Yeah, chlamydia, because a lot of girls here, when you're growing up, chlamydia can cause infertility. So we all fear that one. It's just as one of those things you hear in that health class in your 8th grade when they're trying to scare you into not having sex anymore. That's one of the things they.
You didn't even start it yet anymore.
They're like, never have sex, you'll get chlamydia and you'll never be able to have babies. So that's one of those things we are tested for often.
But I guess necessity was the mother of the creation of Shameless Care, because as Robert was saying, he didn't realize. And I think a lot of people who are listening, and even for us,
Yeah.
we didn't realize that oral swabs were something. We thought, well, if it's one place, it's going to just show up in all of the testing and everything is good.
And a lot of doctors think that too. Yeah. So there's no shame in you thinking that, for sure.
Yeah, it's a common misconception. Many infections are site specific. So if you have gonorrhea of the throat, you could test negative through your urine and anal swab. And that's true of all of those locations. I mean, you can have gonorrhea of the anus and chlamydia in the vagina, and they've never cross-contaminated. I mean, there's all sorts of areas where you can have that happen. So that's why you've got to be tested in all of the sites.
I think knowledge is such a powerful thing where if somebody would talk to me about STIs before I came into this world of open relationship, ethical non-monogamy, swinging, whatever you want to call it, how illiterate I was. But until I actually started listening to your podcast, I would say.
And we forgot to mention that they also do a podcast.
I just learned how illiterate still I am in this arena that I thought I got it. I go and I get the panel every 3 months between my husband and I. And we just covered. I guess we're not.
Well, I find that's pretty common in the lifestyle. Actually, a lot of knowledge just passed from person to person, kind of like old traditions. And unfortunately, there's not always scientific data in that. So that's where a lot of this gets lost. You said, well, my person who ushered me into this taught me this, so this must be canon. And in truth, it's just what they knew. And that's where the science can fall short sometimes.
Yeah, absolutely. But I think it's really critically important that we remember, and your listeners remember, that sex is really fun. And we live in this golden age, right? Where like HIV, if you engage in high risk HIV activities, and we can talk about those, but if you do, then there are these miracle drugs now that can prevent you from becoming infected. If you do become infected, there's these miracle drugs that can help you live a completely normal life. And the infection that I got, gonorrhea, as I mentioned, I didn't even know I had it. And I got a shot of antibiotics and it was cured. And I feel like we oftentimes, obviously, I think STIs are important. It's why I started the company. It's what I've now dedicated my life to. But at the end of the day, sex is really fun. And we do live in kind of this fun, free love type of, 1960s environment, if you will, where everything is either preventable or completely curable. And we shouldn't lose sight of that. We want to help educate people, but we also don't want to create more anxiety.
No, not at
because
all.
we just feel like there's plenty out there.
So how long has the company been? When did the company start, or when did you found it?
We launched in May of 2022. So I guess about 3.5 years now, boots on the ground. Yeah.
Okay. And the state of sexual health in the lifestyle, have you noticed any changes in it since from when you started to now?
You know, one of the nicest things anybody's ever said to me was Stan and Lacy from the Swing Nation, which some of your listeners may be familiar with. And they said, Robert, we don't know what this means for you financially, but there's way more people in the lifestyle now know more about throat swabs than they did before you came along. So that's really what I hope, because we've just talked about it not for 3.5 years. This idea that if you're going to get STI tested and you have unprotected oral sex, because you probably do, not just people in the lifestyle, but if you look at the national statistics, almost everyone does, then, for heaven's sakes, collect cells from areas of the body where you might be infected. So
And
we
you have
still have an
contact.
awful long way to go. Yeah, where you have contact. Yeah, exactly.
Yeah.
There's still such a long way to go. I mean, on Reddit, somebody will say, where do you get STI tested? They'll be asking the group. And I'm just sitting there being like, okay, fine, but they don't have throat swabs.
They don't.
Somebody else will say, oh, my TRT doctor just runs it in my blood sample. He taking a blood sample anyway. People think they're getting a full STI panel from their blood work. So I would say overall, the knowledge about STIs, like the confidence is high. The knowledge doesn't meet the confidence level for somehow. But I would like to think that we're chipping away at it as much as we can.
And you are. You're producing so much content. It's amazing.
Yes.
Oh, thank you. Thanks.
Yeah, I know it's totally on our end. Also, it's dedication to love project. There is definitely a lot of knowledge needed there, and thanks for sharing.
Of course.
Thank you.
I would also say what is more common that we see in our positive tests that you wouldn't think of. We see a lot more oral gonorrhea, and we see something called mycoplasma genitalia. We see a lot of those come up positive. And then we see trichomonas that comes back positive a lot as well. And those are things that you tend to not be tested for at your doctor's office if you go and in for testing. They're just not things that a lot of clinicians know to even test for. So those are things we see more in the positive testing fields at Shameless Care than we would see other tests that come back positive.
So what are you seeing as some of the challenges in people getting tested regularly, and are, we doing it in general often enough?
Challenges, I would say that it's this overconfidence, which, I'm raising, people, your listeners can't see me, but I'm raising my hand right now. That was me.
Sure.
I had to be knocked so hard off that peg, somebody texting me, hey, but idiot, you gave me gonorrhea, and me being like, no, I didn't. I'm looking right at my results right now. Like you'd have to imagine my confidence level, everybody, and then to see me get knocked off that peg. And it's not easy to do what you feel like is the right thing, to feel like you're really progressive on STIs, which virtually everyone who's sex positive does. They see themselves as a champion. And then to find out that maybe you're not doing quite the right thing through no fault of your own. It's because your physician also doesn't know, and that sort of thing. That's challenging. So I think that there's this real confidence level where, like when Anna and I go to New Orleans, for example, and give a presentation on STIs, it's probably the least popular presentation of any of them in New Orleans. Why? I imagine it's because everybody's already getting STI tested. They feel like they've got it covered and they know what they're doing in that regard.
A lot of people, I think, includes all of us. Hey, we're going to an event. All right, flip-flops check, bathing suit check, and, STI status check. And you have that, and you wear that as a badge of honor. It's like, look, I'm responsible. I did all this to prepare for an event. And who wants to go to an event and then be told, yeah, you really didn't prepare as much as you thought you did?
Yeah. I would say another shortcoming in this field is actually no fault of the people who participate. And that is, they may even go to their clinician and be really honest and say, hey, I'm going to hedonism next week and I want to make sure that I'm tested for everything. Please test me for everything. And that clinician can only operate within the realm within their education and within their electronic medical record system. And unless you're an infectious disease specialist, they're probably not going to check all the boxes just because they have to remember literally which boxes to check in their EMR system, which is harder than it sounds.
Mm-hmm.
And, especially if you're going to a primary care doctor, they see 40 different patients in a day. Everybody has different things. And you're putting your doctor on the spot saying, hey, I need a full panel. And that can be daunting because you've got to remember which STIs, what locations. And so unless you as a patient walk into your clinician's office with a full list saying, look, I want an oral swab, I want an anal swab, I want a urine test, I want a blood test, and list all of those tests that you want done, you're probably not going to be tested thoroughly. And again, that's not their fault. It's not your doctor's fault. It's just part of the system and how that works. So that's one of the shortcomings as well. And then also there are certain companies that will say, hey, we're a full panel or we're a 10 panel, and people have confidence in that. They say, yeah, this is the thing. This is all of the things. And unfortunately, it's just not. So it's that, again, overconfidence, but on the other side of that table as well.
Speaking to the last part of your question there, a minute ago, you asked, what are the challenges? And then you asked about timeliness, I think, of
Yes.
testing.
Mm-hmm.
People have limited resources, both money and time, right? And so I've always erred on the side of thoroughness over timeliness. Some people suggest, well, you should get a full STI panel, whatever that means. We've already talked about there's no definitive term for that, but you should do that after every new partner. Well, for some people, that might be a few times per month, right? I mean, it gets to be like a little bit difficult to do that. And so you're going to have to make some trade-offs. And I just don't think the trade-off should be thoroughness. For example, this is going to sound silly, but if you follow me through this, I think it'll make sense to you. It really doesn't matter how often you're tested for syphilis. You're never going to know if you have Mycoplasma genitalium, for example, unless you're tested for Mycoplasma genitalium, right? So if you go get a test that has syphilis, HIV, gonorrhea, chlamydia every single day for 6 months, well, that's great, but you still don't know if you have Mycoplasma genitalium. And some of these infections can live in your body completely asymptomatically for years. And so just understanding that certain trade-offs are going to have to be made, I've always erred on the side of thoroughness rather than frequency. So I can't tell somebody how often they should get tested. For some people, that might be every couple of months. For others, it might be twice a year. For some people, it might be once a year. It depends upon their sex life and their resources and everything like that, how much time they have, for heaven's sakes. But for me, I've always erred on the side of thoroughness so that whenever you get that test, you have a really good understanding of what your situation is at that particular snapshot of time. Because if your test isn't thorough, then you just don't.
And I think that's a very different way than most people are looking at it, right? It's like, oh, I get tested every 3 months, so I'm good to go. But that's definitely the component that I think most of us are missing is the thoroughness of it.
Right. And
right.
that's why
the
we have
the porn industry does both, right? Because they have to go every 2 weeks and they have a specific checklist they have to make. But they're also making their living having sex, and most of us just aren't in that situation.
Right.
Not that I wouldn't mind just to be able to just live my life and not for the entertainment of others, but, be able to just, hey, what are you doing? Nah, I just got a blowjob, nothing
That could
crazy.
be the top priority in our world. That would be great, right?
Yeah. So would you mind explaining to our audience, how does an experience going through testing with Shameless Care operate as opposed to going to my doctor or one of the many other sites that are out there? And I want to leave this one caveat. Something is better than nothing. So people who are having testing with other places and other things, we're hoping to put out this information to inform, to let you know, like, hey, there are other things out there to test for, but it would be a lot better to have some form of testing than to go out there blind and pass something on that is normally picked up on all these other tests. Because we've heard stories about people in the lifestyle before, like, oh, I went to get my 10 panel and it showed something. And it's like, okay, so it will show if you have something. It might not show everything you have, but getting tested, this is not to discourage people from not getting tested. I hope that our listeners realize that.
Okay, great question. So at Shameless Care, whenever somebody orders a testing panel, they're assigned one of our board certified physicians. So we have 24 doctors on the team, and they cover the entirety of the United States. And so if somebody lives in the state of Arkansas, for example, then they're assigned a board certified physician who lives, well, who may not live in Arkansas, but is licensed in Arkansas. And then that doctor reviews that patient's medical information, things like their medical history. Are they on HIV preventative medication? Have they ever had syphilis? Any allergies? What their pharmacy is? It's what's called an asynchronous visit. So the patient fills out that information, and then the doctor reviews it sometime, over the next few hours, essentially. And if the doctor deems it appropriate, then the doctor orders testing for the patient, and a testing kit is sent to the patient's mailbox. Be there in a couple of days, right? And it has, a urine tube and a throat swab and a blood collection kit. It has everything that you need. The patient collects the samples themselves, drops them back in the mail, and then once it gets to the lab, the results are ready in 2 days. Then those results are read by that doctor, the same doctor, who then reviews the results and conveys that to the patient through the medical intake portal. And if the patient does have something like Anna was saying earlier, the most common things would be like Mycoplasma genitalium, a chlamydia, something like that, then the doctor treats that patient for free. That's not free to me, but it's free to the patient. Because at the heart of this, yes, we're a testing company, but we're really a medical company, and the doctors are the heart and soul of the company. And so when a doctor has a real doctor-patient relationship with someone and has taken on that responsibility of screening them for sexually transmitted infections, they also have a responsibility to treat that patient as well. That's what doctors do. They don't just tell you, well, you have chlamydia, for another $150, I'll send you a prescription. It's like, no, you have chlamydia. I'm the one that ordered the test for you. I'm responsible for treating you. Here's your prescription. And so that prescription is sent electronically right to the patient's pharmacy, which is why we had to collect allergy information and other medications you might be on and things like that. There's this new thing now in the industry called direct to consumer, where lab testing companies are sending lab kits to patients. There's no doctor involved in the process at all. So I just want to kind of set the difference there, set the stage there, that every single thing that we do is focused on these physicians and goes through the physicians.
And what's cool about these doctors is that they're all sex positive. So you can be really honest about your history and not have to worry about being judged, because a lot of clinicians tend to be a little prudish. And so you don't have to worry about saying, hey, I had this amazing gangbang this weekend. By the way, like,
well, I don't know that you
worry about what happens after that. So that's one of those things where you don't have to worry about the judgment when it comes to these doctors as well. You can be honest with them and not have to worry about, it getting spread throughout the town by some doctor or whatever. They're not supposed to with HIPAA compliance, but you don't have that worry component with it as well.
They might say, thanks, I wasn't asking.
Yeah.
That's amazing, because I will say, when I went to my gynecologist and, we were talking and I was like, well, I'm non-monogamous, the shock on her face, if I was a different person, may have prevented me from having further conversation about the topic and prevented me from discussing the things I needed to talk to her about. So that's great that they all know what's coming at them and they're all sex positive. That's amazing.
I have a quick question. How does the blood work gets sent to the doctor?
I just did that. I just did that a few minutes ago because I was making the instruction video for our new lab. It's what's called a dried blood spot card. It's a card that has 10 little spots on it, and you poke a hole in your finger with a lancet, and then you put drops of blood in the card and fill in all 10 circles and mail that back to the lab. Yeah, it's called a dried blood spot card.
That's awesome.
Yeah, if anybody's ever had a friend or a family member with diabetes and they do those little finger pokes, it's just like that. So that's another reference that people might have in their brains.
Super easy.
Wow, that's
Yep.
awesome. So much better than draw bloods of like God knows how many gallons.
Gallons.
Yeah, if anybody's ever had a phlebotomist, go through the backside of the vein or anything like that, it's
None of those worries here.
the Lancet's not always terribly fun, but there's not much that can go wrong as far as something like that. You'll have a little bit of a sore finger for a few hours, and that's about the end of it.
That's pretty amazing. Technology is an amazing thing.
So as you've been doing this Shameless Care and operating it, what were some of the challenges you had coming into the space? Because we already mentioned another company that offers it, but there are a lot of other companies that offer this service, and even some of the actual labs itself. You can actually go on a lab website and say, I want testing, and you can kind of click and they'll tell you, okay, we'll do the testing. How was it like coming into this space where it's kind of might have been saturated, or it had been like, well, we have all these other labs out here. What are you doing?
Well, I think I overestimated how supportive the lifestyle community would be in a way. I mean, I was a member of the lifestyle community and used to run lifestyle events actually. And I know how it is. You try to work with different companies, and most of them want nothing to do with you. For example, if you run a swinger club in the United States, you can't even get a checking account unless you lie to them about what it is that you're doing.
Yep.
Yeah.
And so I really thought that there would be like this, oh my God, I can't believe this guy is doing this for us. How can we help him? Haven't ran into a tremendous amount of that, I have to say. For whatever reason. So I thought there would be a place for us in the lifestyle that I've just, for some reason, have not found a whole lot of that. So I do kind of find myself competing with these larger, companies. So for example, if I go to get Google ads, I'm bidding on Google ads against Wisp that probably has $1 billion market capital. I have a $0 market capital.
That
So
can
the
be a
stakes are
problem.
just higher. The stakes are just higher for me. And then I also refuse to cut any corners. So when I've talked to investors, the thing that they just cannot believe is that I won't back down from this idea of super comprehensive testing. And that's why when you look at other companies, they have a gonorrhea and chlamydia test that doesn't have throat swabs. They have like a test for whatever you can afford, essentially. And I get that. But to me, I have this rigidness in my brain of like, we're going to test people thoroughly, or there's no point in the company existing at all. I don't want to be a further part of the problem, right? And so that's part of our issue. But I always thought that there's so many men in the lifestyle that are using ED medication that if those men would switch to us, that financially we would be fine. And we actually cost less than all of those companies. We don't have subscriptions, which I think I hate subscriptions. Raise your hand if you've ever forgotten to cancel a subscription. I think we're all raising our hands.
Everybody's hand is up.
And I have just not made the case to people in the lifestyle how important this is, because on Reddit, somebody will say, hey, what ED company do you use? And everybody there knows I'm in the Reddit community. And they'll still be like, oh, we love Roman, or we love Hims, or we love Blue Chew. And it's like, okay, thanks for the support. Thanks for the support, guys. So that's been the challenge, and it's on me. I haven't made that case properly. It's certainly not their fault. It's my fault.
So how are you spreading the word about how we need to do better? And how are you building trust within the community to try to get the people within the community to listen that, yeah, there's 10 paddles, there's those other ones, but this is really comprehensive, is really the way you need to go.
One of the things I really love about Robert is that his mission is about giving people the power to advocate for themselves and giving people the ammunition they need. So if you go to shamelesscare.com, and let's say you've got really awesome insurance, and for those of us who work 60 hours a week, we work really hard for our insurance, right? And so if you go to the shamelesscare.com website, you can click on one of the links at the top, and it's going to list every single STI that's in the panel that Shameless Care offers. And you can take that list into your doctor's office and say, please test me for these things in these sites. So you can literally just show it on your phone, or you can print it off if you're old school like me. And you can also, if your doctor says, well, I don't know what a throat swab is, how do I do that? There's a video you can click, and it's a 60-second video that you can have your doctor watch. And it's another doctor communicating with your doctor saying, it's just this swab, you run this test, this is the code, and it just teaches your doctor how to do that test.
That's amazing.
So there's a bit of altruism when it comes to this, because to Robert, it's more important that people are tested with confidence, because let's be honest, the more confident you go into a sexual experience, the more fun you have having sex, right?
So true.
Yes.
And it just makes you feel so much better. You'd be like, I've got this. I know what I am positive for. I know what I can take to help prevent infections, because Shameless Care offers medicines to help prevent STIs as well. And it just, again, anything we can do to make your sexual experience more positive, more confident, get away some of that anxiety that comes with that. That's what's important to Robert. And I think he undersells that a lot. But as a clinician and as a participant, that makes me a lot more excited. I want to support somebody who's more about making sure people are going into this knowing and just having that empowerment, because that's what this is. It's an empowering experience. It's not somebody trying to just take your money. It's somebody who wants to empower you to have a great time and to do so without spreading things to other people. And I love that about Robert and how he runs his company. So that's just me kind of being a cheerleader, right?
Rah,
No,
rah,
that-
rah, rah,
Yeah,
rah,
that's
rah.
amazing. I mean, the fact that you're even telling people, oh, you can go do this on your own without me, right? Because you want them
Mhm.
to go do it the right way. So that's incredible. You mentioned preventative care, outside of like the typical everybody use condoms and whatever. What do you offer in that realm?
Well, one of the things that I'm really excited about is DoxyPEP, and I'll explain what that is in just a minute. But as someone who looks at STI test results all day, every day, basically every single thing that we see come back positive, for the most part, could have been prevented with DoxyPEP. And so let's just take a time out here to talk about what happens when somebody tests positive for an STI. I'm not trying to scare anybody, but I think we should just take a time out here to realize it. One is you're probably going to have to take an antibiotic for a good bit of time, 7 to 14 days in most cases, or maybe an injection. You're going to have to disclose to whoever's been your partner. It's not like you legally have to, but most people are going to be sending some unpleasant text messages to people and saying, oh, by the way, I have chlamydia or whatever it is, right? And you're gonna have to abstain from sex for a while, and that's not great. And your case, and this shouldn't scare anybody, but it's just part of the process. Anytime somebody in the United States in any of the 50 states tests positive for many of the STIs, there's something known as mandatory reporting, where your name and your age and your race and your address and all of this kind of stuff is transmitted to the local county health department as a positive gonorrhea case or as a positive chlamydia case, that sort of thing. And that's how the CDC ends up getting all of these like rock solid statistics. So it's not getting an STI, not a big deal, also kind of a big deal. It feels like a big deal at the time. What DoxyPEP is it's the antibiotic doxycycline, which has been around since the probably late 60s, something like that. I just had a mole cut off my face a couple of weeks ago, and the dermatologist prescribed me doxycycline so I wouldn't get acne while it healed. This is an antibiotic that's used for a lot of things and has been for a long time. But if you take 200 milligrams of it within 72 hours after sex, it pretty dramatically lessens the likelihood of contracting gonorrhea, chlamydia, and syphilis. Gonorrhea, less so, but for chlamydia and syphilis, it's close to 90%. And it's been wildly effective. Gonorrhea, chlamydia, and syphilis, all three, everybody thinks STIs are climbing out of control. This is the third consecutive year that gonorrhea has decreased, for example. So it's been a huge public health win across the country. And that's probably one of the things that we sell the most of. And that, I think, is a smart bit of preventative care. There was some misinformation, really, when it first was released about its effectiveness with cisgendered women. And this is an interesting story. I'll quickly summarize it. Basically, there was one study done, and this involved women in Kenya. And the statistics showed that while there was a reduction amongst these women in Kenya in STIs, it wasn't statistically significant. Whereas in the studies that involved men who had sex with men, it was a home run, showed a huge reduction in STIs. Well, the researchers then took hair samples from these women and found that most of them who were supposed to be taking DoxyPEP had not taken any doxycycline at all. They were not honest about taking the medication. And so it hit the clinical guidelines from the CDC, and it says, well, there's not enough information to show that this works in cisgendered women. And that, I think, was really unfortunate because it kept a lot of women from taking DoxyPEP and no doubt causing a lot of STIs. There's since been another study out of Japan which showed just a home run success rate with DoxyPEP and female sex workers in Japan. And the science shows that doxycycline is in enough of the cervical tissues and the vaginal tissues and things like that in more than high enough concentrations to help prevent some of these STIs. So DoxyPEP, I think, is one of the things that's particularly exciting.
One of the things I love about DoxyPEP as well, when you just take it after an unprotected sexual encounter, is that it doesn't increase your risk of things like a yeast infection or bacterial vaginosis.
Oh, wow.
And that's really important to us girls.
Yeah,
Sure
definitely.
is.
Yeah.
If you just have to take one dose after, and it's literally just one dose after a sexual encounter, you don't have to really worry about that stuff. Because unlike when you do get an STI and you have to take an antibiotic for 14 stinking days, well, yeah, you're going to get a yeast infection from that.
Yes.
But if you just take a dose preventatively, you don't have to worry about that drama. And that's another huge sigh of relief, another vote of confidence that, hey, you know what? That guy did go down on me for 30 minutes and it was fantastic, but I don't know if he was throat swabbed. So you just take that dose of doxycycline afterwards, and then that worry is reduced significantly, and you don't have other consequences down the road, which is, again, a huge breath of fresh air.
Yeah.
I like when you said 30 minutes. Good timing.
Yeah.
Yeah,
Well, you know.
At a minimum.
At minimum, yeah.
That's
Just dive in and stay there.
So a lot of what you're saying, and hopefully the audience is getting it, our listeners, is that reducing the shame around STIs and the testing and prevention definitely helps. It increases pleasure and intimacy and makes you feel a lot freer. Now, I'm going to play devil's advocate here, and I'll ask, because of all of this, are there any studies that are showing that because now people feel that, oh, I have the PrEP and I have this and all of these other things, an increase in more high-risk behavior?
Well, good question. I don't know of any studies, but I do think that there's a good bit of assumptions that can be made, that particularly amongst men who have sex with men, who of course never had the pregnancy concern, right? But HIV and AIDS was a horrible epidemic for 40 years, I guess, maybe
Yeah,
30.
Still being in a lot of people's nightmares. Yeah.
And I tell you what, 2 years ago, I was in New Orleans at the event where I met you guys at, and I'm sitting at the bar and strike up a conversation with this guy, and his brother had died of AIDS in the 1980s. And he started to tear up there at the bar. And I think a lot of families have that story. I have a family member with HIV right now. And so when people talk about that with PrEP and DoxyPEP, is that going to enable people? Is that going to empower people to do things like have sex without condoms? I got to be honest with you, I don't care. Like if it frees them from that worry, then I think that's absolutely fine. I think that should be everyone's goal, is that we don't have to worry about these STIs. If someone is a homosexual, for example, and has a lot of anal sex with other men, but they can take this magic drug that Gilead and the United States government provided us with, a miracle, an obvious, God honest miracle, and it takes away that fear and it saves lives. Fine. I think that's awesome. I don't see the harm in that at all. I think it's fantastic.
Well, thank you for that. And, I'm asking because your company is called Shameless Care, and a lot of people, and I kind of speak for us, we're not necessarily out. Some people know that we are in this lifestyle, but it's not something that we share. And there's already the thought and stigma that, oh, those crazy people that go and have sex with everybody and anybody. And if you've listened, at least from us, that's not the case. We are very selective and keep our circle small,
Tight.
and it's tight, and we try to, kind of keep things amongst ourselves. As Pinky says, we have a kitchen table poly dynamic on how we do things. So just asking that because I know it's something that a lot of people think, and one or two people who outside of the lifestyle that know, it is a question that kind of comes up. Like, you'll just fuck anybody? I'm like, no, I won't. But, I take as many precautions as possible. There's nothing that is zero risk.
And I have to say, my experience, I've been in the lifestyle now for almost 7 years. The partners I've had in the lifestyle are way more careful and way more aware than anybody I dated prior to being in the lifestyle or becoming non-monogamous. I think the majority of us understand the importance of testing and being safe. And now it's just a matter of learning what kind of testing is the full type of testing that we should
Just
be
have
doing.
to add a couple more tests to the list. That's all.
Yeah.
But I do see a
Another
very
thing-
different mindset.
Another thing that I think is important when it comes to a lifestyle mentality is consent, right? We're always about checking in, and we also check in with ourselves, right? So what do I need for me? What do I need for my mental health? And what do I want to participate in and not participate in? And I think that's one of those things. If you have confidence in your testing and you have confidence in the protection you want to take and the things you want to participate in, that also helps in this situation, right? Because you're giving yourself the ability to consent with even more,
Enthusiasm.
knowledge.
Yeah.
Yeah, I will say this with a loud, clear voice. Swingers do not have more STIs than the general population.
Right.
I mean, I would know that more than anybody in the United States. I've tested thousands of people in the lifestyle very thoroughly, and I would say the rates are kind of right on par with what I see for statistics in the national population. So, for example, with sexually active young women in the United States between the ages of 17 and 24, 1 in 15, as we're having this conversation, has chlamydia. That's way more than what we see in the lifestyle. What we see in the lifestyle is kind of what you would see if you did a survey on like a random 50-year-old woman, right? It's not going to be very high. That's kind of what we see in the lifestyle for all of these infections. And, the only cases of HIV we've ever had were people who already knew they had HIV. Oftentimes men who have sex with men, they've had HIV for a very long time. The infections we see are not any higher than they are in the general population, and they're easily treatable.
So just asking, you have a lot of data and you're talking with this, and we talked about HIPAA and all of these things, and we just want to be sure to remind people, as much as you're getting all of this information, it's not identifiable. Am I correct?
Oh, absolutely. Yeah.
Yes. So we want people to be assured that as Robert is talking about, hey, we gathered this data, it's not linked to a person where if you use the service and you happen to run into Robert or Anna at an event, it's like they know.
Oh yeah, no.
No. So I just want to give
Yeah, no.
give our listeners a little bit of pause. They're not looking through your information. This is just results, and it's not linked to a specific person or a patient.
If the sexual
Correct.
wellness had a motto, what would it be?
Oh, that's a really good question.
I think one of the mottos that we almost chose for our company is have your cake and eat it too.
Oh.
Hmm.
You know,
I
we've
like
all been
chocolate
told our
more.
entire life. Yeah. We've all been told our entire life that if you have casual sex with new people or just casual sex in general, you're going to get pregnant, you're going to get an STI, you might even, if you were born in the 80s like me, then it was you're not only going to get an STI, you're going to die
Right.
from that STI. And, you know, that doesn't have to be true these days. Sure, I got an STI after 20 years of non-monogamy, easily cured. It's really no different than had I got strep throat on a cruise ship or something like that. It's just a simple bacterial infection. And I feel like with proper testing and then proper education and maybe even some of these preventative treatments like DoxyPEP for people who are interested in them, you really can have your cake and eat it too. We really do live in an amazing time as far as STIs go.
For me, and I think this is because I'm a clinician and I spend 12 hours a day with patients, I would say the motto I would give it is take care of others as you would take care of yourself.
Yeah.
That's excellent. Yeah.
Well,
Right. So if you're going to find a new partner and you're really into them, you want to take care of them. You want to have that passionate connection. You want to have that amazing moment. And you want to take care of them as you want them to take care of you. And the more you know about your sexual health, the better that can happen.
Yeah.
Well, I'm going to jump in on this. And if you guys like it, it's free, it's yours, and you can keep it. But here we go. So, pleasure is powerful, but it's even better when you care for yourself shamelessly.
Mm.
I like that.
We should switch jobs. I don't know what your job is, but we should switch jobs.
That's okay. You can just send the residuals. That's all right. That's fine.
That's a good one, King.
Yes. So, one other question, since we're all on health, and what is something that everybody can do every day to maintain their sexual health? We all know drink a lot of water, get 8 hours of sleep. Any suggestions? Anything out there that you might suggest to our audience?
Brush your teeth before sex.
I like that. I think exercise is the obvious one.
Okay.
You know, we sell a lot of medications at Shameless Care, but none of them work as well as exercise. And I'm struggling with this right now because for the past year, our company has been on the precipice of greatness or going into the
Gutter.
The gutter is the word I was looking for, of history. And we're always just riding that line. And so there's been a lot of 18-hour days, and a lot of times I go down to the gym and then I'm like, I just start working again. That's really not a good idea at all. So I would say that exercise is definitely the number one thing that people can do.
I mean, I'm going to echo that in that, you know, blood flow, right? Blood flow is what gets tissues aroused. No matter what gender you are, blood flow is what gets those tissues pumping. And so if you're able to take a walk, do some stretching, anything like that to increase your blood flow, that's going to be awesome. So I will echo exercise, but the other thing you can do for your sexual health every day is educate. So the 2 E's, exercise and educate, because the more you learn, the better.
Yeah. Knowledge is power.
Yeah, it is.
So we've had a lot of fun and learned a lot being able to sit down and chat with both Robert and Anna, and we want to thank them for joining us and giving us their time. Before we kind of really wrap things up, you ladies have any other final questions? Ava?
No, but thank you so much. This is eye-opening and I learned a lot. And it gave me a lot to think about moving forward that I didn't know I needed to think about. So thank you.
Pinky.
Well, I'm actually on your website right now, and it's 14 panel test, and I'm clicking, and I have my doctor's appointment on Friday. Yeah. Let's see how it's going to go.
Yes, and I would like to give everybody the opportunity to find out more about you and the services that you offer. So can you share with our audience where they can find you?
Absolutely. Shamelesscare.com. And we offer not only the STI testing, but a range of sexual health medications. Things like Shamelessly Aroused Cream, which is topical sildenafil cream for women, which increases blood flow. Nasal oxytocin, which is my favorite medication. Valacyclovir for HSV prevention, DoxyPEP, like we talked about, ED medications, and some others. And be sure that you use coupon code 3SHADES, that's the number 3, and then shades, and you'll get a discount on any of your orders. And you'll also be helping to support the podcast. And I know from personal experience how much work a podcast is. So these folks really deserve it. So if you're listening to them right now and you're using a service and you'd like to try Shameless Care, please do use that coupon code 3SHADES. And of course, if you want to write to us, you can just fill out the contact us on the email on the website, and we'll get back to you right away.
And we know that you guys do a podcast. So where can people find your podcast?
Well, you can download Shameless Care, the podcast, at basically any place you get your podcasts, Apple, Spotify, name it. But we put out 2 podcasts a week. It's all science-based. And so if you want to be a sex nerd like we are, it's a good place to educate yourself. And we have a lot of fun. There's a dirty joke of the week. And yeah, I love to laugh. So you're going to hear a lot of my laughter at Robert's really cheesy jokes as well. So
I love those jokes. They're so cute.
So now you're on the spot, and you're going to have to bring us out with the dirty joke of the week now. You said it, so you got to do it.
Oh.
Well, give me just a second. I'll remember one.
I was thinking of the pharmacy one.
All right. Well, there was a very buxom blonde who went to the pharmacy, and she told the pharmacist that she needed a prescription for arsenic. And he's like, "Excuse me, what?" She goes, "Arsenic." And he goes, "Why?" And she goes, "Well, I want to kill my husband." And he's like, "Well, no, what on earth? There's no way. No way. I'll lose my license. You'll go to jail. I'll probably even go to jail." About that time, she hands over a picture, slides a picture across the desk, and it's a picture of the pharmacist's wife in bed with her husband. And the pharmacist looks at it and he goes, "Well, that's different. You didn't tell me you had a prescription."
Okay. All right. So we want to thank Anna.
Is that from the same book? That
No, that one you found
that was
online.
pre-Larry Flint book. Yeah.
Okay.
That Larry Flint book is awful. 90% of those jokes in there I cannot read on the podcast.
So we want to thank once again Robert and Anna for joining us. And all of their information will be down in the show notes. So on behalf of myself, Pinky, and the salacious Ava Moore, we want to thank you all for listening. And we will see you on the next episode.
Stay salacious.
That's my line. Stop stealing it. Bye.
Bye.
Thanks for tuning in. If you enjoyed today's episode, be sure to visit our website at 3shadesofgrey.com. That's the number 3shadesofgrey.com, and sign up for updates, exclusive content, and more. Want to keep this vibe going? Follow us on our socials at 3_shadesgray, at Ava Moore _3 shades, and don't forget to check out Pinky and her salacious, soul-stirring poems over at Polly _poet. Until next time, stay salacious.